If you look from a distance to this hospital, the hospital buildings, everything is quite modest in a way. But once you go in and become a part of the team, then you realize that something extraordinary goes on in this hospital every day.
3,000 patients a year, about 8 every day, get lucky on what could be the worst day of their life. After a devastating accident, they're rushed to Denver Health and Hospitals, where they come face to face with the orthopedic trauma team.
Most of us work 80 to 100 hours per week for years in order to take care of the high volume of highly injured patients who come to us from every corner of Colorado, every mountain and plains city, as well as our surrounding states. We have full-time surgeons dedicated to trauma, not doing trauma as a small part of their practice because they have to, but because it's their passion in life.
But very few trauma centers take the very worst cases.
We're the only center within 5 states that makes itself available 24 hours a day, 7 days a week to reattach limbs, and in particular to handle the worst and most tragic of hand and upper extremity injuries.
Dr. Steve Morgan handles many of those cases.
Usually when I meet people and they ask me what I do, I mention that I'm an orthopedic trauma surgeon, and they say, well, I've never heard of that. And I tell them, you know, don't really want to be in a position to meet me. That's not a good situation.
I knew that I was hurt because my brother kept telling me to not look down at my feet. So I knew that my leg was very injured.
Kori Pothour lives in WILEY, Colorado, just up the road from Lamar.
I was on a four-wheeler with one of my friends, and there was a car coming towards us, and we decided we should pull over, and we caught the edge of the road. The pickup hit the four-wheeler, and I actually don't remember much after that.
The truck slammed into Kori's leg.
I mean, if it had been 2 seconds later, you know, that it just hit here and flipped it, you know, just a split second of any time makes a big difference.
An ambulance rushed her to the ER in Lamar.
They told us there that she had severe leg injury and they would be flying her to Denver Health. She was talking to us and everything, but we were worried.
At Denver Health, Dr. Morgan was on call. He got Kori stabilized, but her leg was bad.
Approximately 10 inches of bone was what she was missing.
The injury was devastating to Kori, who was a standout volleyball player.
I just was worried about walking again. I wanted to get better soon and play volleyball, which was very important.
To walk well and play volleyball, Kori needed a below-the-knee amputation and prosthetic, but she was missing too much bone. So Dr. Morgan proposed an innovative surgery that had never been done before.
Despite the fact that her injury was very massive in her leg, her foot was spared. And so what this allowed us to conceptualize and do was to utilize the foot and the bone in the lower part of the leg to reconstruct the missing soft tissue and reconstruct the missing bone to give her an appropriate below-knee amputation.
But would it work? Dr. Kagan Ozer faced a similar dilemma when 16-year-old Mitch Helfer arrived at Denver Health last October. Mitch had wound a rope around his hand during a tug-of-war game. The rope tightened and pulled off his hand and fingers.
It was underneath here, here at the thumb, and at the wrist in 3 places, and it severed everything, leaving just a little bit of skin on, holding everything on.
All bones were fractured, and all nerves and arteries were avulsed and ruptured. As far as the severity is concerned, it's the most severe in its class.
In 6 surgeries so far, Dr. Ozer has grafted arteries, nerves, and skin taken from other parts of Mitch's body.
We weren't sure if the hand would make it, and it'd have just an arm, a forearm, not even a wrist. That's a big, big, big disability. And it's not just a disability from the physical standpoint, it's also a big trauma from the psychological standpoint, especially for a 16-year-old.
Mitch and Kori seem like they have extraordinary injuries, but there are so many similar cases.
We take people with severe injuries that left untreated or poorly treated would certainly make them permanently disabled for the rest of their life. And our goal and mission is to return them to the highest level of ability, not disability, so that they can return to their work, their life, their families.
6 months after his devastating injury, Mitch can already play with his nephew.
Hey, buddy. I don't think it's really gonna affect the way I live. I'm not gonna let it, at least.
As his treatment continues, he expects to be able to play football. Kori's astonishing bone graft worked. She was fitted for a prosthetic leg just a few months after the accident. Not that you can tell which leg it is.
The girls always tease me because I wear a sock, a real sock. But it's like, you know, oh well. You can make it as normal as possible.
Every day I come to work, I feel tremendously lucky to get to interact with people like Kori and other people and hopefully make a positive difference in their life.
All the money in the world doesn't come close to patients telling you thank you and really meaning it.
The doctors on the orthopedic trauma team are renowned for the care they give each patient. They're regarded as among the best in the world, publishing in prestigious scientific journals some 50 times a year. But the doctors don't think they're the superstars here.
To come back from some of these severe injuries and then to renegotiate your life, that is a feat that whether you're Cal Ripken or Michael Jordan or Mario Lemieux or any of these great MVPs in sports, I think all of them would agree it's at least equal.
I always feel very fortunate that I ended up at Denver Health. I know they've done amazing things, and what they did for me was extremely amazing and extremely life-changing. I'm very thankful to be here today.